And with that, I'd like to introduce my fellow legislator, Bill Burton, who can speak on some of these alternatives. Thank you.
Thank you, Judy, and thank you, Pete. Back in early December, a bunch of us fiscal conservatives got together and held a press conference at the Board of Legislators where we outlined in considerable detail, under the leadership of County Legislator Mike Kaplowitz, a series of departmental consolidations and administrative reductions which would have saved in excess of $6 million and would have probably led to even further reductions as the process was implemented. We were opposed, and in fact we were defeated. And one of the reasons why many of us voted against that budget was because had we been able to implement those cuts, we would have in fact been able to bring in a close to a zero tax increase. But we were opposed, and we lost, and we decided that we had to make a point, and we voted no. Now, what were those? Because they've been ignored. 3.5 months into the new administration, we have not got any meaningful proposals at all to reduce administrative overhead, but we have $1.5 million dropped on the table to say, cut the kids now. No, you don't cut kids now when you're not willing to cut the overhead first. That's simply misplaced priorities. There are other things that can be done. Westchester County has a very good health care program for its employees, and it has a company that administers it. And we find that if we take the example of the Westchester Medical Center, which took the same situation and evaluated it, they were able to reduce their overheads for medical insurance, not changing anything else, but just reducing the overheads by an excess of $15 million. 10 times what's on the table now, cutting kids. We can do better because we have many more employees. Have we done anything about this at the administrative level? No. There has been no proposal by the administration to use those opportunities. And that could be 15 million, it could be 20, it could be 25 million. Who knows? Because the administrative effort has not been put into it. There are so many other alternatives that should have been put forth first. Instead of saying to the children, you're on the chopping block, your future is impacted, you're the ones who are going to pay. No. Administrators pay first, and then we'll discuss how we're going to make the cuts in all the other programs. Now, there are a lot of people who really need to speak out, and I'm going to start by asking Kathy Hallis to stand up here and talk about the perspective of the child care community providers, to let you know what it exactly is going to do to the whole structure of child care in this county. Kathy.
What's the status of these proposed cuts? They seem to be in limbo with the legislature and the county executive discussing.
Unfortunately, absolutely not. The administration has proposed that it will freeze Title 20 applications as of the 28th of April, I think it is. It was to say
April 1st.
April 1st. I'm sorry, it's already done. It means that, and they can do this administratively, no new kids will be put into a program which has already been budgeted for. So that's a cut, flat out. They are recommending that child care scholarships be cut, and that's an action that the Board of Legislators has to do because we're the ones who made the budget. So there could conceivably be a battle there. This is the sort of thing that is simply misplaced priorities. Let's go after the duplicated administrative structure. Let's go after all of the issues that I raised earlier having to do with the way the medical programs are done. Let's not start with the kids.